Hello and welcome to my channel. This is Dr. Melanie Tidman. Thank you for taking the time to view this video as a first of many short research presentations. Please like, subscribe, and hit the notification bell so as to not miss any future videos. Please remember these presentations are for informational and educational purposes only. Please contact your medical team before making any changes. I am a metabolic health practitioner, a professor and director of clinical research for the Colorado Parkinson Foundation. Since 2018, I have been conducting clinical research in Parkinson's disease. Some of my former videos are located on my channel, and you can review the results of my 7 years of research studies in Parkinson's disease. I invite you to review them and to comment if you find them useful, educational, or if you have any questions. The research that I'm reviewing today is a short version of the full presentation, which I will link to in the description. Today I'm going to be reviewing the effects of a community-based exercise program on mobility, balance, cognition, ADLs, sleep, and quality of life in Parkinson's disease, a community partnership pilot study. I conducted this study in 2018, and you can review the full article presentation on my YouTube channel. At the end of this presentation today, I will highlight some practical applications from the study article to address symptoms you might have and to apply to your daily life. So I hope you find this useful. The aims of the research study that I conducted in 2018 was to evaluate the efficacy or effectiveness of an 8-week community-based exercise program at 3 Colorado Springs YMCA locations for adults aged 50 to 85 with Parkinson's disease. In our study, we had 16 male participants and 6 female participants. We also had 21 Caucasian participants and 1 who's classified as other. We also investigated their educational level. As far as high school education, there were 3. Some college, there were 4 participants, and a college degree were 15 participants. All participants were assessed by the study neurologist, Dr. Brian Grabert, so he could determine and evaluate them for their stages of Parkinson's. We determined that we would exclude those in stages 4 or 5 because mobility would have been an issue for them. So all of our participants were Hoehn-Yahr stages 1 to 3. We had 36 participants enroll initially, 26 participants started the study, and 22 participants completed the study exercise program, which was 8 weeks. The exercise classes were held 2 to 3 times per week at 3 YMCA locations. Only participants who attended a minimum of 75% of the offered sessions were included in the study data analysis. Participants could choose to attend 2 or 3 sessions a week. This quasi-experimental one-group pre-post-test design involved 22 participants with Parkinson's who participated in 2 to 3 exercise sessions per week for 8 weeks. Their quantitative outcomes that were assessed were balance, mobility, cognition, activities of daily living, and quality of life. The MOCA cognitive assessment was performed after the study period. The results showed that the non-significant results, it came out to be a p-value of 0.05. So it was trending towards significance, but it demonstrated that there were some improvements. We did the 4-stage balance test, which again scored at p-value -0.5, which meant it was a positive trend towards significance with a p-value of 0.07. It's possible that the study group just wasn't large enough to have statistical significance, but we did find clinical significance. So for a practitioner like myself, clinical significance is a big deal. Other results included their analysis of an Epworth scale. An Epworth scale is a survey done to measure your daytime sleepiness symptoms. Pre and post Epworth scale scores were compared. Individual scores improved in 11 of the 22 participants. So 50% of the participants indicated that they had improvement in their daytime sleepiness. But again, this didn't achieve statistical significance, but showed some positive clinical significance. The qualitative themes that we investigated included things like energy, socialization, motivation, and then our quantitative results were flexibility, balance, coordination, strength, and mobility. You can see on this scale that I'm showing you that socialization achieved a huge improvement in post 8 weeks participation in this community exercise program. Of course, the limitations of our study were the fact that it was a small sample size. Only 22 participants completed the 8-week intervention. I find that you need a minimum of about 30 participants for your results to be achieving statistical significance, and you can do different statistics to indicate the significance with a larger sample size. We also had a 15% attrition rate. That's people who dropped out either before the study started or after the study had started. So typically you expect to have about a 10% attrition rate. So our attrition rate was a little on the high side. Another problem was that our study duration was rather short. 8 weeks is not a long time to see statistically significant results. Another limitation might have been that we had some pretty high functioning, pretty physically active participants who were physically active prior to the exercise program. So perhaps inclusion in the program didn't show a vast amount of improvements, but we know that just the maintenance of good motor skills is also clinically significant. We also used a convenience sample. Most of our participants met with a Colorado Springs support group with the Colorado Parkinson Foundation, and research has shown that people that are involved in support groups do much better. You have much better outcomes and a much better quality of life. We had a higher educational level in our sample, and at 68% of our participants having a college degree, this also might have skewed the results somewhat. So this community-based exercise study revealed some positive qualitative trends in socialization, coordination, flexibility, balance, and some minor improvements in strength and motivation to exercise. The study period was 8 weeks, and participants could attend 2 to 3 exercise sessions a week. We saw positive trends and improvements in daytime sleepiness, but we recognize that ours was a pilot study and future research is needed to assess the effectiveness of a community-based exercise program in Parkinson's disease. So as I always like to do as a metabolic health practitioner, I feel my role is to review research studies, do research studies, publish research studies, but also try to apply what my impressions of research are to your daily life, give you some practical tips. So we know that people with Parkinson's disease experience symptoms that interfere with your daily life functions, especially in mobility, balance, cognition, self-care, and quality of life. And we found that these symptoms could benefit from inclusion in a community exercise program. We also found that Parkinson's patients often experience social isolation. They withdraw from community-based activities, but this participation could be addressed through joining an organized community-based exercise program. We know that people with Parkinson's experience some psychological symptoms, social isolation, depression, apathy. And we also found some positive trends in addressing these symptoms after an 8-week exercise intervention. We know that everyone, me included, can benefit from regular exercise programs. We know that exercise programs that are 8 weeks or under may not prove as effective as those that are longer in duration. We showed that socialization can improve. We also know that as you exercise to improve your metabolic health, your neurological health will improve as well. This article was published in the Neurodegenerative Disease Management Journal in 2019. My co-researcher was Aaron Skotze, who many of you who participated in this study remember meeting her. She was a PhD student of mine. Thank you for watching this brief research review. I hope the suggestions are helpful, and please check out my YouTube channel for other daily practical applications in my short research reviews. Take care, everyone.